Stan, I'd love you to introduce your partner in crime, John, and then we do have a slide deck tonight, so we can go from there. So you make the introduction, and I'm going to open up then I'm going to do the screen share.
Yeah, I mentioned a little yesterday about John. He's a very self-deprecating man who's made a remarkable living being one of the best finance advisors in the United States for decades. Smart. He did it in a very intelligent way, too. A lot of the client acquisition happened on the front row of the Utah Jazz basketball games for many years. But so his background is finance, but he's a brilliant man in so many ways. And his short stories, he had a brush with death that was a genetic predisposition to heart disease. And his father, his grandfather, uncles, other men in the Hewlett family had come to early demise as a consequence of heart disease, heart health. And he had a brush with that and determined that rather than having the standard operating procedure of having his chest cracked open, that there had to be a better way. He'd actually, when the medical doctors discovered his cardiac problem, it was a function of them having botched a surgical procedure about a few days before. And they had clipped a vein and sutured him shut, sent him home with some painkiller, and he came back within a day because he was bleeding internally, bleeding out. And they couldn't figure out why or where. And there was some miraculous, some wonderful divine intervention to solve that problem. But in the meantime, they were telling him as he was bleeding out, hey, you have a heart problem. Why don't you subscribe to our heart program? No, I think I'll take a rain check on that.
Take a rain check on that one, yeah.
Take a rain check on that. I'd like my bill, please. I want to leave. So that really was a motivation for him to pursue a path of better alternatives to that standard operating procedure. In fact, some of the numbers, John, you probably know some of these numbers as well. You're conscious of them, but the percentage of revenue in the hospital system that's generated as a function of cardiovascular procedures, and it's over 80%. And there's a reason that the established, the institutional medicine is really not trying to solve that, rather manage it. So imagine, the sweet irony in John's life as he's been pursuing his own knowledge of natural health and the way that the body works. That to read up on this miracle molecule, the science magazine called the miracle molecule nitric oxide. Very simple molecule, but remarkably complex in its ability to perform feats in the body. Well, in 1998, the Nobel Prize is awarded, and the conclusion of that award is a statement from the American Heart Association that, well, we've solved cardiovascular disease. Nitric oxide makes such a phenomenal beneficial impact on the cardiovascular system that now, we can see the demise of cardiovascular disease. And we can talk a little bit more about what it was that was discovered in that. Why the Nobel Prize was awarded to these three physicians in 1998 for what they discovered relative to nitric oxide and its relationship with the cardiovascular system. But what an irony. And what a wonderful work that John has done for many years to really talk to some of the smartest people on this planet about this simple molecule, the simple gaseous molecule, and then to wrap his arms around its functionality in the body, and how to put together something that distributes, that creates the body's ability to manufacture, to make that molecule naturally, and in a way that is bioavailable, in a, as the in a specific place. There's a gradient, actually. Tom, I mentioned this because you indicated how well educated your audience is. But this, well, we can get a little bit further into this in the Mulinski study, but that what John has created here actually was proven out to produce nitric oxide within a specified gradient of the endothelial cell wall. We'll talk more about endothelial cells, but that's where this molecule is created, is within a specific gradient of the endothelial cell wall. If it's not created in that exact space, then the molecule cannot perform its signaling function. And so I'm just laying some groundwork here. We can talk more about those specifics, but that's part of John's history, is really putting together a nutrition supplement that, when tested at one of the best labs in the country for this purpose, the conclusion was shocking to the PhD who was doing the work, who was doing the research, Dr. Mulinski, to see the conclusions at the end of his study that were so shocking to him, that he called John and to say, "You're a genius and you don't even know why. I can't believe I'm looking at the results I'm looking at." But so John's had that journey for, gosh, John, how many, 10 years? 15 years of talking to the smartest people on the topic, and really just, it has not been an easy path. But fortunately, we're here now. We have remarkable science. You read the Mulinski study. And, I think I mentioned yesterday, we're starting clinical trials this week. We'll have some remarkable evidence, we think, that will come out of those, as well as some world-class science that Emergent Systems Technology, a Massachusetts biotech firm, is doing on the ingredient list, some in situ or in silico testing.
Well, I want to give a personal thanks to John, because you told him I had a little case of COVID, and he called me right up and.
Oh, he's personable. And, he takes this personal, man.
gave me some suggestions on increasing my dosage of nitric oxide precursor, which I immediately started doing. I was on it. I was on beets. I was on everything I could to improve my vascular health. But the dose makes the poison. The dose makes the cure. And I was under the circumstances underdosing. So
yeah.
Sam,
you probably had a sense. You probably had a sense when you talked with John that he's on a mission.
Yeah, I felt simpatico.
Yeah, he's on a mission, and the mission is to heal the hearts of people. Literally. Absolutely. I'll say again, Tom, we're just great. We're grateful to be here with you this evening, and with your with those that follow you and learn from you. So.
And we also have Dr. Carter in the house, who's our chief medical officer, and he couldn't make Monday, but he's here now.
Hey,
was Dr. Carter? I think I had the pleasure of meeting you at Truth About Cancer, I believe.
Absolutely.
Yeah,
you did.
I remember.
Yep.
It's great to see you.
You too.
Thanks. Well, yeah, let's up to that first slide, Tom, because they're a little different conversation than yesterday, or a different approach. I became very, very curious as the current virus situation began. To take a look at the forensic autopsies. The reports that were published regarding the forensic autopsies from the patients who had passed as a result of the COVID virus, right? And so what the following slides are going to show is some of those findings, which were first published. The first publications came out in March of 2020 out of Sweden, Germany, Spain, Switzerland. And so on, and it shows a progression. And I think it'd be interesting for folks to see this progression because as this first slide identifies, the first forensic autopsies were performed in Sweden on COVID patient deaths, and the quotations here are right out of that study. And here's what they found, because they actually had no idea what they were looking at in terms of causes, but what they were seeing was the consequence of whatever was operating in these bodies. So the quote here is, "Tiny clots and dead cells littered the capillaries of the lungs, and inflammation had distended blood vessels supplying every organ in the body." The virus had targeted the blood vessels.
Right.
This was their hypothesis. These were their observations, right? We can hop to the next slide. So they formulated a hypothesis based on those findings. And their hypothesis was that whatever was the cause was actually damaging the endothelial cells. Not just blood vessels, but specifically the endothelial cells. Subsequently, this is language from a publication in May on some additional autopsies that direct and indirect damage to the endothelial cells that line the blood vessels, and particularly in the lungs. So what was happening here was that, well, whatever this virus is, it's attacking this interior lining, the endothelium, and causing the blood vessels to leak, which causes, which they said they cause a cytokine storm of epic proportion, and that as a consequence of that storm, then the body would go into shock, and the primary organs would shut down. Let's go to the next slide. This study from the New England Journal of Medicine was the first time that the photographs were published of vascular structures in the lungs, pulmonary vascular structures. And so you can see here in this far right paragraph that the transmission, this is the first transmission of electron microscopy of the COVID-19 endothelium, showed ultrastructural damage to the endothelium. Compare the left image to the right image, and you can see the brutalization of the vasculature, the microvasculature in the lungs. And so, as we begin to think about the purpose of our cardiovascular system, the purpose of the vascular system is to carry the data in our liquid organ, right? To carry the data in the blood, and some of these in the microcapillaries, they're so small that even red blood cells yield to that size, right, Tom? I mean, they bend and fold in order to be able to get through these remarkably small pathways.
And we're actually, just as a sidebar, we're having the group from New Life on next week that are going to hopefully demo how they can measure your capillary bed, the diameter of capillaries, and how important it is to have, very small micron capillaries if we want to get perfusion into the diffuse tissue. So it's extremely important.
Yeah, and so on that point, let's create why is this relevant right now? Because we begin a conversation talking about this gas molecule, nitric oxide, being a Nobel Prize winning a molecule, well, so, what's the relationship between that molecule and why are we looking at these pictures and learning that this virus attacks the endothelium? As it says here, as we've seen here, the intersection of these conversations is the fact that the nitric oxide is produced by the endothelial cells. And the endothelial cells are the only type of cell to have direct contact with our blood. And even more, what's more, as I learned more about the endothelial system, it's the largest organ of the endocrine system. That the only type of cell from which capillaries are made is endothelial cells. So imagine where you have a virus that is targeting endothelial cells to damage them.
Mm-hmm.
That's a hard message. You say with truth is sometimes hard on the ears. That's a very difficult message to comprehend or to take in. That we have and as we look at some of these subsequent studies, we'll find that it's not only the virus that is targeting the endothelium. As it turns out, it's the spike protein.
Sure.
Regardless of the virus, the spike protein is targeting and attacking the endothelium to destroy it. That becomes exceptionally relevant and in my mind, a global curiosity. If it's the fact that the capillaries, the microcapillaries, form 80-90% of our vasculature, and they're made up of only endothelial cells. Let's go to the next slide, please. Thanks. So this was a study published in Circulation Research, April of 2021. SARS-CoV-2 spike proteins impaired the endothelial function. So this was the first study that came out that bifurcated the damage being caused to the endothelial cells by spike protein, the spike proteins, rather than the virus itself. So here's the quote from the study: the spike protein alone damages vascular endothelial cells by downregulating the ACE2 receptor and consequently inhibiting mitochondrial function.
I feel that statement.
Yeah. Mm-hmm. Expand on that, because I get what you're saying. Expand on that for the rest of the listeners, the rest of the participants.
Well, guys like you and I, Stan, we measure our health very accurately, particularly our athletic performance. And since I've had, the virus attack on me, I can measure my VO2 max.
Yeah.
I can measure my anaerobic threshold, but I can even just use simple metrics like how many sets of a certain leg press I can do now compared to before.
Yeah.
And
before you're tapped, right? Before you start experiencing oxygenation problems.
Yep. And I've lost oxygen, not carrying capacity, but transport.
Yeah. The other thing that stunned me, thanks for sharing that, Tom. The other thing that stunned me about this study is these photographs on the right here are of the mitochondria. And this study highlighted the fact that the spike proteins fracture. That was the verb they used in the study: fracture the mitochondria inside the endothelial cells. So when one of the symptoms we experience as a result of this virus, which is not necessarily related to the virus, but the spike protein, is I have no energy. I can't breathe very well. Well, number one, where the damage being caused is primarily to a large degree in the pulmonary tissue.
Mm-hmm.
And then in addition to damaging endothelial cells, you're damaging the mitochondria, endothelial cells. And the mitochondria are the touchstone of biological energy.
Mm-hmm.
So go figure. But talk about striking at the foundation of life, right? So the other thing as a logical consequences, you can understand what they noted in the studies, the spike protein impairs nitric oxide bioavailability. So it damages the endothelial cells, damages their mitochondria, and as a consequence, guess what? Nitric oxide production declines because the engines that produce it are dysfunctional now, they're damaged. So that was one of their specific findings as well. And that this final statement here on this was really one of the things that was kind of an uppercut to me as a result of this study. The spike protein exerted endothelial damage overrides the decreased virus infectivity. Like the viral infectivity isn't the thing. The spike protein damaging endothelial cell results is the thing, and the challenges it presents to the mitochondria. So you begin to see where there's this overlap between what the virus and spike protein are actually doing to the endothelial cells, which are the cells that interpret the data from the blood. That, you know, if the blood cannot communicate oxygen delivery beyond the vascular walls into the interstitial tissue, then where are you?
Stan, let me ask you.
Yeah.
Let me ask you a very simple question. I'm going to mute you for a second, Michael. But Michael, you can come back on in a second. But so, how would you feel about giving a spike protein through a vaccine to someone that is otherwise healthy?
That's a question for me.
I figured I'd ask you.
Yeah. Well, being raised on a farm, I used to do a lot of bird hunting. You know, we raise some of our own food and stuff. If I intend to hurt something, I load the gun with something that I know can hurt the thing. I wouldn't shoot ping pong balls at a pheasant. You know, you shoot something that has some damage.
Right.
The spike protein, it's proven, and we can get to the end of an Italian study. That Italian study that was published in September of 2021 that stated we have now proven that COVID-19 is an endothelial disease. The spike protein it's a component in the injections. Why would I want to introduce that? On the theory, because it is a theory. We don't have any clinicals on this. On the theory that my own cells are going to recognize that as something that my body made because of this mRNA gene therapy, and now my body's going to begin producing spike proteins. To what advantage? Oh, you're hoping that my immune system is going to respond to that. My immune system is going to respond to something that my body makes. That's problematic math for me, biologically speaking. But my body's going to fight something my body makes. Okay. So I don't see natural immunity is not a function of, if there was anything normal about what was happening in terms of procedure, Tom, if we weren't changing definitions of modalities and things like what's the definition of a vaccine, and now it doesn't create immunity, you're going to change the rules to that degree in order to do what? It just doesn't. It's almost like a Hamlet test. You know, there's something foul in Denmark. Something smells bad. It doesn't pass the smell test.
Mm-hmm.
So that's my response. Plus, given I've spent quite a bit of time with David Martin, and I've reviewed the patent record very, very closely. I've spent many, many hours in the patent records, and the evidence is cumulative. It's too much. It's cumulative and dispositive. The patents on the injection, the patents on the virus, etc. Mm-hmm. So, and it's not theory. I mean, there's not, as a lawyer, I can tell you, there's not a more precise document, legally speaking, than a patent. There just isn't. Mm-hmm. They have to be precise, and you know that very well. So, and all this has a bit of a pall. It casts a pall over any conversation, because this is dark, and so it gets so dark, like you can't even discern shadows. But the good news is that there's hope. There's hope. Let's move to the next slide.
I appreciate your answer very much.
Well,
I was kind of curious to hear Dr. Carter's response after reading the real Anthony Fauci to all that, but maybe we'll save that.
Well,
in reference to kind of this topic, more specifically with, let's say, the mitochondrial dysfunction, yeah, I mean, that's driving down the energy production, and that's, really paramount to get that back up to peak efficiency, because of course, I'm getting a lot of patients, now, and some who are waiting too long. Unfortunately, some individuals are thinking it's a cold or what have you, and they're coming to me 5 or 6 or 7 days down the road because they thought they were recovering from it, and now they're in the throes of it. So it's harder to, pull them out of it. But definitely, I would say the Cardio Miracle. I've been on it for, I don't know, probably 6 months or so. I mean, but again, I take a lot of supplements, but I really like the Cardio Miracle because obviously has a ton of stuff in it. It's very easy to take. It's very palatable, and from just what has been described here, it hits a lot of those avenues in terms of bringing things back online and so forth. But from the standpoint of where we're headed, oh yeah, it's this is not over by a long shot. Not even close. Nope. So, and I think Omicron is a breather, but there's some more stuff that people have no idea what's coming. And yes, I'm a big fan of David Martin. Follow him, quite extensively. And yes, there are tons of patents and all of this stuff. And people are going to have to step up their game. I mean, there's just no doubts about it. You cannot relax on this at all. Period. There's no doubt about it.
Very well
said.
Thank
you, Dr.
Michael.
Carter. Yeah, thank you.
Said.
Well, on the what a great kind of transition for the conversation. I mean, this statement here comes from this study that I mentioned earlier that was published in September 9 in the Lancet last year. Where the researchers had administered L-arginine orally to severe COVID afflicted patients in the hospital. So just take a look at this statement. We have demonstrated that the endothelium is a primary target of the severe acute respiratory syndrome, coronavirus 2. And L-arginine has been shown to improve endothelial dysfunction. A very powerful statement. Let's go to the next slide. But they suggested, they wrote that in that same study that what they had done provided a rational framework toward treatment therapy. A rational framework, which I thought was a really nice choice of words given some of the irrational behavior and irrational thinking that has plagued us for almost 2 years. So we can dial back a little now. So we've gone through these the findings of these forensic autopsies, and then this kind of momentous, hopeful academic paper that says, hey, we found something to help the body heal itself. Because L-arginine is, you don't need a prescription. It's an amino acid, right? And fairly ubiquitous. I mean, quite available, not expensive. And so, but as we back away from that, come to, again, this question of why L-arginine? Why does L-arginine create the outcome of improving the endothelial dysfunction caused by the spike protein? Well, so the Nobel Prize conversation, and Dr. Carter really focuses on that, right? There were two basic findings for which the Nobel Prize was awarded. One was that that nitric oxide is the signaling molecule for the cardiovascular system. And then secondly, that nitric oxide is made by the endothelial cells. In fact, I think we have in the next slide, Tom, we've got a photo, we have an image of these three doctors.
Okay.
Yeah, and that's a great study as well. And so up to the time that these three had identified, I'm sorry, let's see here. There we go.
That's probably a longer deck.
Yeah, I was going to say this is our abbreviated deck. That's fine. But here's so those three scientists, what they the process by which they discovered that nitric oxide was the molecule they were looking for is a really interesting story. They called it was an X factor. They were trying to figure out this X factor that in their experiments that was communicating to the blood vessels to constrict and relax and to function properly. They noted that when they stripped out the endothelial layer, the interior layer of the blood vessels, that they stopped responding that way. They stopped responding to blood flow as produced by the heart. They would not flex. They wouldn't constrict. They wouldn't expand. They would act as if they were atherosclerotic. And then when reconnected with vascular tissue that had endothelial cells intact, it began responding again naturally in a supple way, in a flexible way, as the vascular system should. So that's when they figured out, nitric oxide is the thing that's communicating to the blood vessels to do this. And as a consequence of their findings, which were quite extensive, their conclusions were, as we said at the top of the conversation, Tom, that the president of the American Heart Association said, well, we've solved cardiovascular disease now. And you brought up that study yesterday by Clayton Christensen about information disruption and how long it takes information to get from that petri dish, so to speak, to the rubber on the road traction. And it's been many years since 1998. And we have a more significant cardiovascular disease problem in the United States than we did in 1998. So some of the So John's work, this is where, John's work enters in with nitric oxide, his brush with death, and trying to find a natural way to facilitate his body's ability to heal itself. And as a consequence, we have a cardio miracle. To the point that we've talked about how the spike protein damages the endothelium. This is a quote from a specific study, Tom. The endothelium is the communication interface organ. So we talked about all the data that the blood carries, the nutrition data, the hydration data, mineral data, polyphenol data, oxygen data, all the data that all the cells need outside of the blood vessel wall to live and to thrive. The endothelium is the communication interface organ to communicate the data from the blood to the tissue outside of the blood vessels. So maintaining a healthy endothelium is paramount. And as it turns out, when the endothelium is producing nitric oxide, it's healthy. It also acts as the endothelium acts as like a Teflon coating inside your blood vessels. So in your arteries, it prevents the adhesion of platelets and lipids, and other material that's traveling through your vascular system. So it maintains a smooth surface of the endothelium, which allows for the blood to have its mechanical reaction along the interior of the blood vessel walls and arterial walls by this mechanical force, which induces the endothelial cells to produce nitric oxide. This shear force of the blood, just its reaction along the blood vessel, along the arterial wall, the capillary walls. What actually happens when those two meet? So a fat is the biome around the endothelial organ is fascinating relative to the blood. I know you like to keep things simple, and so here's one of the ways of looking at this in a simplified way, but not simplistic way. And that is the blood is life. You remove blood, the human dies, regardless of how healthy the body is. So the health of the blood is paramount. The movement of the blood is paramount. The health of the blood carrying system is paramount. Absolutely fundamental. And it begins, a lot of that begins with the interior lining of the blood vessel walls, because it has the only connection to the life-giving liquid organ. And nitric oxide is really the primary mover in that communication system between the blood vessel and the blood. So maintaining the health of that relationship between the interior wall of the blood vessels and arteries and that vascular system and the blood is fundamental. If you can do a lot of other things. If you remove that from a lot of other practices, the efficacy obviously is reduced significantly. So I can train a lot. I can train a lot, but if I don't maintain the health of my blood and the interior lining of my blood vessels, I'm at a major disadvantage. I'll tell you a very personal story. When I sat down, I went up to John's cabin in northern Utah. He's up in the Park City area, and he handed me this study that was done by Professor Mulinski. I sat down to read that. I read it 3 times. I spent 6 hours with it that night, because a month before that, I had sat down with a doctor by the name of Mansour Muhammad, who is one of the founders of the DNA company. They're out of Toronto, Canada. And he reads DNA like C.S. Lewis could read Shakespeare, just beautifully. And he told me, I was going through a DNA review of him, and he was telling me, he had told me a month earlier, Tom, he had looked at the genes that had formulated my endothelial cells and said, Stan, your endothelium, based on the genetic composition, can either be like you can have a Williams-Sonoma brand,
Yeah.
or you can have something down along the dollar store bargain brand. You got the bargain, or you got the dollar store brand of endothelium based on the genes that made it up, which means that it's going to the wear and tear is going to be more pronounced. It's going to scuff easier, and all these things. You're going to experience more inflammation than otherwise. And he said, Stan, and the next question he asked me, so give me that bad news, Tom. Then he asked me, we're good friends. He says, so what's your resting heart rate, Stan? Right, at the time it was 53. And I said, well, it's 53. He says, well, of course it is, because you're crazy. He knows, he knew that I maintained a nutrition that I have eaten well for decades. But he says, Stan, and I trained all that stuff. He says, Stan, if you were in another reality, if you were a different Stan, like the lawyer that worked, 18 hours a day, came home, sat on the couch and ate fried food and this, you'd be dead. We wouldn't be having this conversation. Or we'd be trying to rescue you. But fortunately, you've engaged in life behavior patterns that have allowed you to perform well, even though you've had a, genetically weak endothelial system. Well, imagine what I thought when I sit down with John to read this study from Dr. Mulinski that says that this nitric oxide substance that he tested specifically, that when endothelial cells were bathed with Cardio Miracle, they immediately began producing nitric oxide. And that nitric oxide production extended beyond 24 hours. So here are some of the findings from Dr. Mulinski's study. These are you see the first page of his study on the right side here, these quotes that are really significant on the left. We elucidated the role of a mixture of vitamin D3, L-arginine, and L-citrulline, and several antioxidants in the improvement of nitric oxide production. So this study illuminates these findings, that there is a relationship. John has been brilliant on this. I might even want to see if I could encourage him to join here, because John is a vitamin D3 proponent. And what he's been able to demonstrate in terms of the bioavailability of D3 when you put it together with L-arginine and L-citrulline to get a reaction, a nitric oxide production from endothelial cells, something magic happens.
What seemed obvious to me is, first of all, Professor Mulinski had the definitive published paper on vitamin D3, I believe it was in 2018. And when I read that in February of 2018, he talked about the impact of vitamin D3 on the cardiovascular system, and that was a major breakthrough. And as many of you on this call may know, it's really only been the last 10, 11 years that vitamin D essentially has come out of the closet, so to speak, and that was primarily when Dr. Oz and Joe Mercola talked about it. I remember it very distinctly and was thrilled to have that endorsement come out on vitamin D3. Of course, now I think the highest search engine's vitamin is now vitamin D3. And so early in my experience with my own nitric oxide supplementation that helped turn around my family heart issue, I've learned about vitamin D3. I didn't know anything about it before my experience, but it appeared to me that when you understood the mechanism of nitric oxide opening up the capillary wall, that then the absorption of the D would be more significant. And so when I met with Professor Mulinski, I asked him, I said, well, my theory is that if you have nitric oxide and vitamin D together simultaneously in the same formula, you should be getting more bioavailable D essentially to do its job. And he he agreed with me, which was, quite thrilling for somebody who, couldn't carry his pocket protector or his PhD portfolio. That was very interesting. And so we've been having this discussion with numerous people since then. And we now have engaged a top research group that is trying to gather all the data among 5.5 million points of research and data, and all of the functions of the 53 ingredients of what we have in Cardio Miracle, and the 650 some odd applicable aspects of those 53 ingredients. And I said to the PhD, he's a very smart guy, I said, I believe that it's 3 to 5 times more efficacious when in conjunction with nitric oxide. And he laughed at me and said, I don't think you know what you're talking about. And 2 weeks later, I got an email saying, oops, I think you're right. And we're waiting for that white paper to be finished. Hopefully it'll be done in the next 2 weeks. That will help validate that with all the existing research. But we all, I think, are united in saying we know that vitamin D is very valuable. I submit that vitamin D with the nitric oxide impact, 24/7 nitric oxide impact, opening up and smoothing out those microcapillaries makes the vitamin D far more efficacious and more valuable to individuals, as opposed to having the majority of it being excreted as a part of the urinary disposal of some of the excess vitamins and things that we get in our supplementation.
Interesting. Very interesting, John. Yep.
Yeah, we'll share that white paper as it comes out, because that's
It's a big deal, because we all know.
It's the crux of what you're doing.
Yeah, it really is. And one of the things that we think is very fascinating and important is that D is finally getting some recognition. Some people are mentioning it finally. It's only been 20 months. I've been screaming about this for 2 years. And so that's good. But nitric oxide still hadn't hit the airways until the other night, Friday night, on Tucker Carlson. And they came up with something that, and we have to be very cautious, just so everyone knows here. Nobody wants a solution that isn't a pharmaceutical solution. So the reality is, we can only say that we published a cellular study that showed nitric oxide over 24 hours at the cellular level. No animal trials yet, no clinical people trials yet. So we can't make any claims other than that at the cellular level of human endothelial cells, the smartest professor in the world validated that our formula extended nitric oxide for over 24 hours. So that's really all we can say. Mm-hmm. But if you connect the dots and listen to a lot of other smart people, you can see that there's extreme value in 24/7 nitric oxide that is buffered with antioxidants to prevent the peroxynitrite issue, the free radical issue that often comes with too much amino acids at one time. And that was another thing. I don't know if you've mentioned that so far, because I was doing some other things, but that's a big deal. So you don't just go out and take a handful of arginine and spike your nitric oxide to the moon, or else you're going to have dilated vessels, but you'll be frying your microcapillaries in the sensitive parts of your body at the same time. So it's really important that you have the balance of the B12, which scavenges excess nitric oxide, but also the anti-inflammatories and the antioxidants that help buffer it, along with a nice dose of vitamin D3. They work very well together.
Brilliant, really.
Yeah, well, one of the things that really set Mulinski back on his heels was, as John says, this buffering effect of the antioxidants and anti-inflammatory, the botanicals and the herbs, et cetera, in Cardio Miracle, that he talks about a ratio in the study, in the paper, this ratio that shocked him, and the relationship, the ratio of nitric oxide production vis-a-vis the production of peroxynitrite, which is this Professor Mulinski calls the most dangerous and damaging free radical in the human biological system. So, but which happens to be inevitably created at the same when nitric oxide is produced. So he was euphoric about seeing the downregulation peroxynitrite production when there was such a significant upregulation of nitric oxide production.
And sustained for the long period of time. And so that was probably the most shocking thing. And just to show the fact how clueless I was, really, I didn't even know what peroxynitrite was. So when I get a paper back saying it reduced it by 50%, I go, well, that's really cool, but what is it?
Is that a good thing?
So, again, I don't claim any rights of anything other than I believe that we've been enlightened, inspired, guided, and the smarter the people, the more they catch it. And that's why we're delighted to talk to you, Dr. Tom, and others who are far more qualified in some of the quantitative and qualified specifics of the physiology. But one of the other things that, I just have collected from lots of smart people, and then I can connect the dots. That's what I can do. But I was really proud of our putting in turmeric and astaxanthin. There's no other nitric oxide supplement that has that in those. And my same theory was, if it can help the absorption of vitamin D3, then for heaven's sakes, let's give it a nice little boost of astaxanthin and turmeric. And then in addition to that, we've also gone ahead and put in some quercetin, which, hello, quercetin's on the radar. It's one of the really valuable things for whatever this is that's going on that we can't really talk about. And so the bottom line is we feel like we have a cocktail of ingredients that help support the body's ability to function in a positive manner. And that's really what we have to say at this point until we can get the clinicals to back it up, which we're starting human clinical trials this month with primarily emphasis on cardiovascular function, diabetes, and kidney disease, which I have some pretty strong feelings of what's going to happen, but I want to prove it. So we're investing to prove that. And then we're doing, obviously, these quantitative analysis of all the existing documentation, which our scientists believe will be even above the heads of the regulators, that they wouldn't be able to figure it out and would be quantitatively as valuable as having clinical trials. So we're doing everything possible to measure up. But in my opinion, when you get the smartest people in the world in the alternative space and the functional integrative medical space, and they're all taking this product, that's a good enough recommendation for me.
So I'm going to go in order, and Paula says, and I've never heard this before, is there time to discuss the efficacy of the nitric oxide push exercise? And I immediately think, Stan, you would know what that is. I have no idea what that is.
Yeah, actually, there are a couple of doctors. Joe Mercola is out there promoting it as well, this nitric oxide push exercise. Here's the value of exercise. It's a little fun. It's kind of funny. But it's good information, because what it highlights is that as the body movement is good. It's good for health because it increases blood flow. It increases a cardio rate. So your heart rate goes up as a response of your body's need for additional oxygen and energy from the blood. Your blood speeds up. So guess what happens when your blood flow increases to optimal levels when you're exercising and creates shear force against the interior walls of your arteries? Your arteries respond by producing nitric oxide. So it's a new message that's really old school. Like, exercise is good. Moving your body's good. Go out and take a walk.
Yeah.
Do some, body weight squats. Do some jumping jacks. Do some, raise your hands up in the air. And very simple movements, but body movement is actually natural for the body.
Stan, some good old-fashioned squat thrusts. Nasty.
You don't need any weight. Oh, your body's plenty.
You just stop. This one might be for Dr. Carter. Is there anything known about graphene hydroxide in the shots causing tiny cuts in the blood vessels? I think that's more spike protein, but Michael, maybe you know something in that area.
Well, again, that's one of those interesting areas where more and more is, being elucidated. and yes, I mean, there appears to be graphene hydroxide in some of the shots. And of course, the newest information that's coming out, which is very condemning, from Michael Yeadon and others, that are showing that there are various concoctions, shall we say, of the vaccines, especially the Pfizer vaccines, and even down to various lot numbers, which one can actually look at, and like for instance, 3,000% incidence in adverse reactions in lot whatever, WZ, whatever, what have you, and then it just kind of goes down from there, and then into placebo. And it was just very interesting. One of my good friends, probably 7 months ago, one of his his girlfriend actually works for HHS here in Atlanta. And it was, he told me about 7 months ago when they were doing the, injections for, the employees, that they had come back, a month or so later and said, well, some of you actually got the saline injection, so you need to get injected again. And I just thought that was quite interesting. And again, that was 7 months ago. So he knew then that there was something up, and now it's obviously coming out that there are.
I don't recall anybody at the government level asking for voluntary participation in a trial.
Right.
Exactly. But it is, right? Unfortunately, we had a federal government, recently, Dr. Carter, tell the FDA that, no, Pfizer's going to have to produce 55,000 pages of documents a month, not 500. We're not going to give them 53 years to produce the documents to disclose the contents of an injection that's being mandated. It's a Hamlet problem. There's something foul. Something smells foul in Denmark, man. It just
no doubt.
So,
I'll take a T-ball one from Brian. Do both the SARS-CoV-2 virus and the vaccine cause the same endothelial damage? And I think you answered that well, Stan. Is that it's really the spike protein, and it's a constituent of both. So that's the common denominator.
Yeah, and that's demonstrable in the patent record.
Let's see. Does the spike protein cause pulmonary arterial hypertension, where you can feel like you can't breathe?
Oh, it absolutely can. I mean, anything that's causing an inflammatory process in the, arterial system, absolutely. I'm getting more and more patients now who, they're finding out that even though they might think they're talking normally and not a short of breath, but I have a time getting people to actually have this at home. Everyone on this call needs to have a pulse oximeter at home. Really, really important, because, most people really have no idea when they're actually hypoxemic, or experiencing hypoxia. And it really sneaks up on you. And so that's a really important thing. And of course, having the Cardio Miracle, as one of the supplements in the armamentarium can help reverse that syndrome, obviously.
Dr. Carter, some folks in the chat have asked, hey, can we be part of that clinical study? We would invite you to be part of your own clinical study.
Yeah, right.
Seriously speaking, because you can, we've had opportunities where we've offered to pay for the blood work of our clients by 60 days of Cardio Miracle, 60-day supply. We'll buy the blood test that bookend those 60 days. And if your blood marker is not demonstrably better, then the product is free. We'll refund your money. Because we want people to understand it's a risk-free clinical trial that you can do at home. You don't have to have your blood, you can, we can send you the information. If people want to do this, Tom, we can set it up. Seriously.
Okay. I will.
We can set it up. We'd be happy to invite people to participate in this because of all the experiences that we've had with this offer for people to actually have their blood tested and see the results from Cardio Miracle. We had one return, which was an athlete who wasn't satisfied with
with their training.
in their training. I mean, at a very high level, right? So
we can chat about this offline and see what that looks like.
Yeah, we're happy to do that. Of course, and that's not necessary. I mean, obviously, we have a money back guarantee, folks. Try Cardio Miracle risk free. I mean, and evaluate how you feel. Because Tom and Dr. Carter, they're phenomenal instruments to gather quantitative data. I was stunned and gratified when Tom showed me what they do. And another great way to measure outcomes is how you feel. It's really subjective. Do you feel better? How do you, more energy? Do you sleep better? There's so many different indication symptomologies that I would wager, Tom, that most of the people on the Zoom call know how to listen to their bodies.
Mm-hmm. No doubt.
Yeah, they understand the language of their bodies. And the body is a great communicator.
Mm-hmm.
And so I can tell you just personal experience that when I started taking cardio over in a serious way over a year ago, that when my body spoke loud and clear. And fortunately, it's not one of the things for me. It was not one of the things I had to wait weeks to get a response on. My body, within a couple of days was telling me, this is good. This is good.
One thing that athletes do, and I tell a lot of people to do this, particularly when they're working with children, their own children or otherwise, is you keep a journal, you keep a record.
Yeah. Yes.
Athletes are very good at our little spreadsheets and seeing how our performance was. And at the level you're working at, Stan, a few seconds is a major move forward, and it takes, precision training to be able to affect that. And so we have to be in touch. But I don't like to say the average citizen, but I think, as people go through programs, I think journaling themselves or doing a 1 to 10 scale on, pain, energy, things like that, sleep, very important to keep track of how you're tracking. To your point, Stan, it's not necessarily measuring CRP or some of the other inflammatory markers. It's some of the more subtle things about how you feel that are extremely important. We're going to run out of time in terms of answering questions. We'll go another 5 minutes, but I think Brian brings up a good one, is that can I stop taking Plavix, with this? But, this is not designed to, quote unquote, treat disease. We're not promoting it as such. And a blood thinner, being on a blood thinner, this is a Dr. Carter discussion, but you're going to have to go back 5, 10, 20 years to figure out how you got to a path of some doctors saying you need to be on a blood thinner. So it's a much more complex conversation than I think we would have the time to really get into. But I think it was important that you brought it up just so we can get into it. This is a supplement. This is designed to increase blood flow, increase the flexibility of your blood vessels, which has major consequences across all kinds of dimensions of health. But I think John brought that up at the very beginning. It's like, we're working to improve health, not to treat specific things.
Dr. Tom, let me interject.
And also,
if I could just interject for a minute. A couple of years ago, a very remarkable study came out from Dr. Stamler from At the time, he was at not the Cleveland Clinic, but the other hospital. Yeah, he's now at Stanford. But he came through the testing, found out a very interesting thing. He found out that transfused blood had no nitric oxide in it. And so one of the things that from that conclusion was that people who get a blood transfusion really should be trying to uptake their nitric oxide, because essentially nitric oxide is kind of what makes blood alive. And so it was fascinating. So one of the things that is so interesting is, as Stan has so well put, that the nitric oxide in the blood is interfacing with the endothelial cell, which is creating the nitric oxide to start with, and then it's interfacing and working together. But the nitric oxide being in the blood is essential. Scripturally, it talks about blood is the life of man. Well, the University of Florida said nitric oxide is the spark of life. And so when you start putting the spark of life and combining it with the blood, and of course we know oxygen's important in the blood, but the same, it's Case Western. It was Case Western University. They came out through Stamler before, is saying that nitric oxide was the third essential gas for human survival: oxygen, carbon dioxide, and nitric oxide. So our mission has been, I've been called by some the Johnny Appleseed, probably should be the Jonathan Winters of nitric oxide. But I've been called the Johnny Appleseed of nitric oxide. But our mission is it does remarkable things. And if people will do their own homework, they'll find that the majority of the cardiovascular medications may be under the supervision of their physician, which is our great disclaimer, be no longer necessary. Because if your blood viscosity is significantly improved by adequate nitric oxide, and if your endothelial wall is not sticky because of sustained nitric oxide, then, I think things are going to be pretty good.
You can be lucky like me. Even if you have a genetically compromised.
John, there are several specific questions about product, which I don't want to take on tonight. But is there someone on your team you can give me the email of?
Yeah, support at cardiomiracle.com.
Let me enter that in the chat. We can email your questions to this, folks. I'll put this email address.
And then I'd like someone to answer this question. If someone just got COVID and cannot get the Cardio Miracle quickly, is it safe to take L-arginine, and at what dose? Any comment on just taking up straight L-arginine as a nitric oxide?
The Italian study, they were, I believe their therapeutic dose was on the 3 to 5 grams.
3 to 5 grams.
Yeah, I'll send you. I can send you the study, Tom. I may be misremembering, but I'll send you the study because we can confirm that, and you can send that link out to your folks.
Got it. So
the better side of it is, but I will tell you honestly, what Mulinski demonstrates is getting Cardio Miracle is the better solution, because taking L-arginine, what they didn't understand and what they didn't test for in that Italian study was what's the consequence of straight L-arginine, high production of nitric oxide over time, given the overproduction of peroxynitrites. It's not a good outcome.
But we're not saying Cardio Miracle for COVID. We're saying Cardio Miracle for cellular endothelial nitric oxide, as proven in the Mulinski study. Period. Hopefully the day will come when we can say all the things that we happen to suspect that it might do and be helpful for.
Mm-hmm. What I'm going to do is make another one of my famous promises on what I probably don't have time to do, but is to save the chats, and we'll do our best. Every month we're having just a straight up Q&A.
Yeah.
And so I'll save these chats, and we can bring
Yeah,
up some of
please.
these questions, but it's almost impossible to go through all of them, I'm afraid, in the
Yeah.
time we have. But
Yeah.
there's obviously great interest. Someone asked about, do I take Endocalyx Pro, which is a brown seaweed product that helps the
Glycocalyx, yeah.
yeah, and that's why we're having the group next week. I think there's a lot of compatibility between you guys, and I think if you're not aware of Stan and John of the GlycoCheck system, you want to meet Bob Long, and for some reason I think he lives in Utah. So I think you have like the 1-2 punch on vascular health right there in Utah. So I know they've agreed to present next week on really looking at the capillary bed under microscopic, using a microscope, LED under the tongue, and there's no question the seaweed products have some benefit in it's more like the mesentery than it is the actual capillaries, but they actually show. I better take that back because I think they even show important changes in the smallest capillary. When we had Kerry Gelb on talking about looking at OCTA, optical coherence tomography with angiography, one of the things they can see with OCT is the dropout of the capillaries. And you don't start by losing a 10 micron capillary, you start by losing a 2 micron capillary.
Yeah.
And so on and so forth. So all of these things play a role. And there was a lot of talk about, the Cardiomiracle and RDAs and minimal things. You never rely on a supplement to provide you all the nutrients you want. If you're not eating well and you're not digesting well, then, you're wasting your money with Cardiomiracle. Or any other
supplements are meant to be supplemental.
Yep.
We're in a time frame. Well, I was just saying, refer to these studies. There's a particular, the largest organ of our endocrine system is under attack. It's by design. Those are the facts.
Those are the facts, man.
Those are the facts. The spike protein is built and designed to attack the endothelium. We encourage people to protect the endothelium. Take direct action to help your endothelium stay healthy. We have the studies that were put prior to the Nobel Prize being awarded. We have the data from that prize. We have over 100,000 studies since that say nitric oxide is the magic molecule. And its ability to, you can read the studies from the Nobel Prize, its ability to solve cardiovascular disease is a matter of fact. It's a matter of fact. And so that's what we encourage when we said, hey, folks, be your own lab rats. I mean, I know Tom does. He's his own lab rat.
I'm just a rat.
Just a rat. We can all test ourselves and find what works for us. And that's what we encourage. We encourage your own research, your own due diligence. Everybody's biological system is a little different. Biomes are as individual as fingerprints. And so test this. And like I said, this is something that you don't run a financial risk to do. If you're not satisfied, we return your money. Period. And we're very comfortable with that because we have so many beautiful stories about how lives get better and people feel better.
And I just want to say that, Dr. Carter and I talking about 4 major mechanisms that drive all chronic diseases. We believe that vascular health plays such a critical role that, we're affiliating with you guys and on Health Revival Partners under SHOP. We offer both the Endocalyx product and the Cardiomiracle product. No surprise. And
so you folks that are looking for Cardiomiracle, go to Tom's and Dr. Carter's site, pick some up. You have questions about it?
Okay.
Call us, email us. Okay. We love to have direct communication with our customers.
And I'm going to do my best to get this video out, published this week, hopefully, and I think it'll be a source of conversation. And I'm sure you guys would come back again sometime, Stan, right, and chat some more.
Absolutely,
and
Tom.
obviously through our blog, we'll be we'll give some information on the testing that you were talking about. So,
Yeah. I'll send you some information on that. I'll let you know when we get the vitamin D3 paper. We'd love to come back and talk to you about that as we learn more and more about the wonderful consequence of the mechanisms of actions that are actually being tested
right
in the Cardiomiracle ingredient list.
Beautiful.
So,
Beautiful. And with that, I thank you, Stan and John, for participating tonight, and everybody listened. So thank you. And then next week we're going to talk about brown seaweed and testing your capillary beds.
Thanks a lot, Stan. You're a hero. I really appreciate you. Thank you.
I got to tell you, I feel so happy looking into this bright, smiling faces of everybody on the call. It's encouraging to know there's so many beautiful people in the world.
All right, guys. We'll see you again.
Great to see you back.